Aminat Medical Monologue, empowering healthier lives through trust. So imagine noticing a small sore around your genital area. It doesn't hurt, it doesn't itch, and after a few weeks, it disappears. So naturally, you think, I'm fine. Whatever it was, it's gone. Then months later, you develop a strange rash, maybe on the palms of your hands or the soles of your feet. Eventually, that disappears too. And then you're like, again, you think, oh, I'm okay, I'm fine, I don't need to see the doctor, right? But here's the frightening part. The infection may still be inside your body, completely silent and eating without treatment. It can remain there for even years. The infection I'm talking about is syphilis. So if the symptoms disappear, does that mean that the infection is gone? Absolutely not. It is not gone, and you need to get that treated. So stay with me, because today we'll be talking about one of the most deceptive sexual transmitted infection in the world. Hello everyone, welcome back to my channel. I'm Dr. Aminat, and this is a trusted home for evidence-based medical education, where we simplify medicine and empower healthy lives. Here we separate medical facts from myths, answer health questions people are often afraid to ask, and give you practical information to help you protect yourself and the people you love. So if you enjoy this kind of content, please subscribe, turn on the notification so you never miss a video. So stay with me until the end, because we're going to talk about the stages of syphilis, the symptoms people often miss, and what can happen when this infection is left untreated. Now, let's talk about syphilis. What is syphilis? So imagine a disease that can change its appearance. First, it gives you a sore. Then it gives you a rash. And after that, it can become completely silent. That's syphilis. And it stays in your body for years. So syphilis is a bacterial sexually transmitted infection caused by a bacterium called Treponema pallidum. Weird name, right? I know. What makes syphilis particularly deceptive is that it progresses through different stages. Symptoms can appear, disappear, and change over time. But please remember, these symptoms disappearing does not necessarily mean the infection is gone. It is still there. So, how is syphilis? How does it spread? How exactly does someone get syphilis? Because these are things that you need to know about. Syphilis usually spread through direct contact with an infectious syphilis sore during vaginal, anal, or oral sex. Here's something important. The sore may be in a place that's difficult to see, so someone may not even know it's there. So you need to be very, 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 very careful. Syphilis can also pass from a pregnant person to their baby during pregnancy and also childbirth. But let's clear up the myths. You do not usually get syphilis from toilet seats, swimming pools, sharing food, hugging, or shaking hands. That's not how you get syphilis. It may spread through direct contact with infectious sores or lesions. That is how you get syphilis. So now let's talk about the stages of syphilis. This is where syphilis gets interesting, because it doesn't always behave the same way. It moves through different stages. So let's break them down. We're going to break them down. Stage 1, primary syphilis. It's called primary because this is the first stage. This is the first stage. It usually begins with a sore called a chancre. And here's the trap. The sore is often painless. It's often painless. Yes, painless. So many people ignore it. They may think it's a small cut, it's just an irritation from my soap, or something that would just simply disappear. And guess what? The sore actually disappears on its own, but that doesn't mean it's cured, because you might think that, but no, it is not cured. And that way you allow it to progress to the next stage without treatment, which is called secondary syphilis. And this is where the body may start sending louder warning signs. A rash may appear, One classic location doctors think about is the palms of the hands and the soles of the feet, because it's weird to get rashes in that place. You may also experience fever, swollen lymph nodes, sore throat, fatigue, muscle ache, and sometimes patchy hair loss. So not every hair loss is because of baldness. But here's the problem. These symptoms can also disappear. Again, the person thinks, oh, I think I'm better. I don't need to get treatment. But the infection may still be there. And that's something so deceptive about syphilis. And then it progresses to stage 3, the latent syphilis. Now imagine having no sore, no rash, no fever, and no obvious symptoms. You feel completely healthy. Then this is called latent syphilis. The infection is still in the body, but there may be no visible signs. This silent stage can last for years. And that's exactly why testing is important and why you should do annual checkups with your primary care physician. Then we're going to go to the next stage because you did not get treatment, called the late syphilis. In some people who are not treated, syphilis can eventually cause serious damage. Very serious. Because years after the original infection, it may affect major organs and body systems including the brain, the nerves, the eyes, the heart, and the blood vessels. At this point, the consequence can be severe, and that's why it's good to seek treatment. So here's something I really want you to understand. Treatment can cure the infection, but damage that has already occurred may not always be completely reversed. That's why we say prevention, treatment is very good. And that's where early diagnosis matters a lot. So can syphilis affect the brain? Because you'll be thinking, oh, it's just syphilis. It can't affect the brain. Yes. And this surprises many people. Syphilis can actually affect the brain. Syphilis can affect the nervous system, and this is called neurosyphilis. I'll go into this deeper if you want me to. Just leave it in the comment section. And it can also affect the eyes, which is called ocular syphilis, and the ears, known as otosyphilis. These complications can occur at different stages of the infection and may cause problems with vision, hearing, balance, or neurological functions. So syphilis is not simply an infection of the genital area. It can affect the entire body. So you need to take heed and be cautious. Now, let's play our favorite game, myth or fact. Myth: if the syphilis sore disappears, I'm cured. No, the infection may still be present even though the sore is gone. Another myth is syphilis always causes symptoms. That's absolutely wrong, because syphilis can enter a latent stage with no obvious symptoms at all. Sore gone, rashes gone, nothing. Next myth is you can tell if someone has syphilis just by looking at them. That's absolutely wrong, because someone with syphilis can appear totally normal. And another myth is syphilis can be cured. Yes, the fact about that, with appropriate antibiotics, treatments, syphilis can be cured. But remember, treatment may not reverse the permanent damage that has already occurred in the person, like nervous system damage, heart damage, the blood vessels damage. All of that may not be reversed. Okay, so now let's quickly go to how is syphilis diagnosed. So how do your doctors diagnose syphilis? Okay, it usually starts with a blood test depending on the situation. So healthcare professionals may also examine or test materials from a lesion depending on the stage. And here's why testing matters. You may feel perfectly healthy, you may have no sore, no rash, and no symptoms, but still need evaluation based on your exposure or your risk. Okay, so don't wait for your body to scream before you listen. Always go for annual checkups to rule out any form of sickness. Now let's go to the treatment of syphilis. Now for the good news, syphilis is curable. The main treatment is an antibiotic called penicillin. The exact treatment depends on the stage of the infection and whether the nervous system, the eyes, or the ears are actually involved, even the heart. So please do not diagnose yourself. Do not borrow someone else's antibiotic. Do not assume you are cured simply because the symptoms disappeared. Go to your doctor. See a healthcare professional. Get tested and receive the correct treatment from your healthcare professional. Next, what about sexual partners? Because sexually transmitted infections will always involve sexual partner. And that part is extremely, extremely important. So if you've been diagnosed with syphilis, your sexual partner or partners may also need to be notified, evaluated, and treated depending on the circumstances. And why? You ask why? And this is because treating only one person may not stop the chain of transmission. You have to treat the partner. And sexual health isn't only about one person. It's about protecting yourself and also protecting others at the same time. So now let's talk about another interesting part, syphilis and pregnancy. Now, I need you to listen carefully to this part. Okay, I need you to listen carefully. Syphilis during pregnancy can be extremely serious because the infection can cause a bad symptoms to the baby and it can be passed to the baby. And this is called congenital syphilis. It can cause severe pregnancy and newborn complications. And we don't want to see that on our newborns. We want them to have the best life ever. And this is one reason syphilis screening during pregnancy is so important. So early detection and appropriate treatment can make a major difference. Okay, so what happens when syphilis is left untreated? Let's bring everything together so that we can all join them together and understand more. Untreated syphilis may affect the brain, the nerves, the eyes, the ears, the heart, and blood vessels. And during pregnancy, it can also seriously affect the baby. So when someone says it's just an STI, remember this video so that you can know what just an STI could cause to a whole generation. Some infections don't stay where they started. Okay? Some infections don't stay where they started. They move on to destroy other organs and affect other organs. So you need to take caution. For example, the pregnant woman with syphilis. Syphilis can cause a lot of damage to the baby, cause a lot of infection that can lead to great sepsis in the newborn. And this is something that we don't want. And that's why we do health screening for pregnant women. So if you want more information about the complications of syphilis, please put it in the comment section and I'll tell you more about that. Now let's talk about prevention. Remember, prevention is always better than cure, as I always say. Use condoms correctly and consistently. And remember, condoms only reduce the risk. But because they may not eliminate it totally because they might not cover the area that is affected. I want you to also get tested based on your sexual activity, the sexual history and risk. Talk openly with your partner about STI testings and avoid sexual contact with suspicious sores or lesions. If you're diagnosed, complete your treatment and follow up with your healthcare provider so they can advise for when next or when to resume sexual activity. Okay? One thing I would like to leave you with is that syphilis can deceive you. The sore can disappear, the rash can disappear, the symptoms can disappear. But without proper diagnosis and treatment, the infection may still be present. So never mistake silence for safety. Get tested, get treated, protect your future health. Okay? Thank you so much for watching. And if this video taught you something new, please like, subscribe, and share it with someone you care about. And tell me in the comment section, before watching this video, did you know that syphilis symptoms could disappear even when the infections had not been treated? Please let me know in your comment section, okay? I'm Dr. Aminat, and remember, knowledge saves lives and prevention protects futures, okay? Stay informed, stay healthy, and I'll see you in my next video. Bye. Aminat Medical Monologue.